introduce yourself, one sentence elevator pitch on what you do, and how is your work differentiated and uniquely making an impact in behavioral health?
Hi, Nick Mercadante. I'm founder and CEO of PursueCare. I'll try to be brief for everybody. So I've spent most of my adult life focused on pharmacy and mental health, specifically trying to solve for issues with care delivery, health equity, lack of continuity for our most at-risk populations that we usually leave behind. PursueCare at its core is a health equity virtual care provider, and we focus on treating people living with substance use disorder, especially in rural areas, remote and underserved communities, people that face a lot of barriers to care. And we really, really focus on treating addiction as more of a chronic, multi-dimensional condition. It's not something simple, and it's not something that goes away. We have to live as a service long-term with the patient. So how we differentiate is we offer a very comprehensive spectrum of services in our treatment plans, and we deliver that virtually through a smartphone app that we've designed for care. Our treatment includes medical care, both for opioids and other drugs, physical health care for sexually transmitted and other comorbid infections, behavioral therapy, psychiatric care for the roughly 60% of patients who benefit from that. And we also uniquely have our own in-house pharmacy for patients that struggle with going to a local pharmacy and getting the help that they need. Uniquely, we also offer the only FDA-approved digital therapeutics for treatment of substance use disorder and opioids. Those are Reset and Reset-O. What those help us to do is engage with patients 24/7 and deliver cognitive behavioral therapy digitally alongside our treatment, and also rewards for lasting recovery. And all of this wrapped together, what it does is it helps to penetrate and reach rural and remote populations in West Virginia and Kentucky, where we started, Maine, New Hampshire, Pennsylvania, and Ohio. And it also leads to 30% higher abstinence rates, improved retention in care long term, and 50% reduction in hospitalizations, which is a cost savings measure.
I think we all have seen that this category has been tricky for a lot of reasons. It's a very tough one from a regulatory perspective. It's very easy to do something that kind of runs afoul of I think in some cases the FTC and other agencies where we've recently kind of seen a lot of this play out. So what are you all doing to ensure that you are providing that convenience and ease of use that's so important to your patients, while also having really strong kind of clinical independence and making sure your clinical teams feel that they can administer the type of care that they see fit, and then managing the expectations of VCs at the same time?
So first I'll start with, I'm a healthcare risk attorney by background, so it always helps to have someone in your leadership that grapples with this stuff. But I think we're in a unique position at PursueCare, being that we're in a highly regulated space of treating substance use disorder. Our patients are heavily stigmatized. There's a lot of bureaucratic stuff that happens at the state level. So even when the federal level is trying to push the ball forward with opening up regulations for things like telehealth and prescribing controlled substances, the state level is, each state has its own unique set of circumstances. So we focus on two primary things. One is go through the front door and work very closely, locking arms at the state level, make sure that you build trust at the community level. And I think uniquely for our model, we're not just reliant on delivering care virtually. We also partner at the community level with physical health care and in-person care for patients that need it. And then the second thing is allow our provider team to be autonomous and follow their own clinical care standards. So we have a dyad. I don't oversee our medical directors and medical leadership. They oversee themselves, and then we work together on that.
Do you think AI is overhyped, underhyped, just hyped enough when it comes to your particular category or company?
At PursueCare, we kind of view AI, we break it down into constituent parts and look for its utilization, oftentimes in non-patient facing ways where we can create efficiency or greater clinical insight from data. We view AI as kind of a stochastic parrot, meaning it's very good at taking data and delivering an answer it thinks you want or is plausible, but it doesn't understand the meaning of those words, right? And therefore, it's not fit to be part of patient-facing engagement where you might end up inadvertently turning a patient off or even tricking a patient with AI in potentially dangerous ways.